We have been talking to so many people and there's so many big topics here in Davos, but just tell us about the conversations that you're having, what's very pressing in the healthcare front.
The really pressing conversation now is because all healthcare systems around the world are under steep pressure, coming from the COVID, but also from the rolling up needs to do intervention, etc. So we are trying to contribute in a constructive way on how to build a more resilient and more sustainable healthcare system. And we are arguing that we can do that and can help with that very much by using science and technology. And obviously there's a pharmaceutical side to that, but there is also a lot of technology as it relates to early prediction, prevention and early detection of disease. And if we can do that, we can actually help reduce the costs, get a much better patient outcome, and also be able to facilitate a much broader coming into that whole healthcare system.
I wanted to ask you about the future of healthcare budgets, because looking at some of the data, of course there's been a boost in spending in recent years on the back of the pandemic, but that's emergency funding that's been deployed. As you talk about stepped up investments in digital and technology, that sounds like it could be expensive short term, even if we're going to get the long term benefits.
Well, I'm not so sure that it need to be expensive short term. There is more technology ahead of us to be used, early screening, AI to be able to look at lung x-rays, etc. And with all of that, we can early detect, possibly, and at absolutely best, we can prevent even disease, and at best we can actually intervene very early. And I don't think there is an immense amount of upfront cost of that, and it's a fairly good payback. The payback of not getting people into hospitals for treatment is very, very high.